Welcome back to the main room, everybody. I hope you've enjoyed yourself in the networking event. I know I have joined several really inspirational conversations, and it's not only incredible to hear the diversity in your backgrounds, but it's also really incredible to hear your passion about One Health. And it really makes, going back to that last question I asked the panelists, how do you see One Health? Well, I see One Health as very bright because of you. So very happy with that. There was somebody who asked me specifically to talk about what One Health is and what the One Health approach is. So let's just break that down a little bit. So the way I describe One Health to the general public, and this is something that you could bookmark in your brain, is that the One Health concept, I break it into the concept and approach. The One Health concept is the interconnection between our health, so human health, and the health of the environment, animals, and plants. Is that connection. The One Health approach is teamwork. It's teamwork of people from different backgrounds, skills, strengths, and disciplines, and we all come together and we prevent and solve complicated health problems. And that's how I explain what One Health is. And it makes sense to the general public. Now, remember how during the panel discussion, we were talking about the bottom up and the top down approach? Well, the top down approach relies on you to be excellent communicators, because you need to go to your elected officials and be sure to explain what One Health is and what the problems of your community are. And so if you go to Amazon, just type in the art of science communication. The subtitle is sharing knowledge with students, the public, and policymakers, and you'll have those skill sets to make you now available and ready to speak with people of substantial power and influence. Next slide, please, LaShawn. I wanted to have some closing remarks here and really drive home, we're not just talking about One Health. We're doing One Health. What does that mean? We're taking action. And here are several ways that you can take action. Not only can you get this book, read it, tell your professors or your older professors about this book, get this to be mandatory reading for your colleagues and for your classmates. And this is not me telling this because, yes, I'm the author, but this is because I wrote this not to sit on a bookshelf. I wrote this to be in the minds and hearts of individuals around the world. So it's a very short read. I'm sure you can do it. But the other things that you can do, next slide, please, is learn about One Health lessons and participate in the mission of One Health lessons, which is to inspire children and adults around the world to value One Health. Next slide, please. Check out onehealthlessons.com next, and you will find that there are 7 different age-appropriate lessons freely available, can be used online, can be printed out, and used in person. And these lessons teach children and adults about where the virus likely came from, how to protect ourselves today, how to protect families in the future, what are vaccines and why are they important, and what are mutations and why are they important. And very shortly, very soon, there'll be a second lesson that's going to be a 2-part lesson about the COVID vaccine, just so that people can understand the science behind the COVID vaccine and, more importantly, the woman behind the science of the COVID vaccine. So it brings the vaccine from a political conversation into a story. And this is really what has happened. And this is a person who was working for decades on this research. You can see that the languages, these lessons have been translated into several languages. And right now, the count is 88 languages because of phenomenal, next please, phenomenal translators around the world. Excuse me. So to volunteer with One Health lessons, you could be a lesson translator, you can become a certified lesson leader, which I'll speak about shortly, and you could be an intern. Heads up, the intern application is due tomorrow. So click on that button very soon if you want to apply for the internship. Next, please. Now, here is something that you can do today. You can sign up for the Lesson Leaders Program. Next, please. There's 4 steps to become a certified lesson leader. The first step is to watch an online training program that's interactive, and it teaches you how to speak with a 6-year-old versus a 16-year-old versus a 36-year-old. Next slide. Step number 2 is you watch a lesson of me teaching children online, and then you have to pass a quiz with 100%. Next, please. After you get the 100% on that quiz, then you observe a live lesson, either virtually or in person, depending on where you are on this planet. Next. And last but not least, you actually teach a lesson. And don't worry, you're not teaching alone. You actually have some backup from somebody who's already taught these lessons. At this point, you become a certified lesson leader. Next slide, please. And you bring these lessons home. The whole point of creating One Health Lessons was not for the English-speaking world. This was for the world. So how are we going to become better communicators in science? We are going to go out into the communities and not only serve as science and STEM and One Health role models for the next generation of young leaders, but we're also going to share our knowledge. Next slide, please. Once you teach at least 5 times in your own community, then you can become a One Health Lessons ambassador. And we actually have graduation ceremonies for these individuals. And you get to be involved in a book club, you get to be involved in a lot of social events, and this network is global. Let's explore with the next few slides really where these lessons have gone. Next slide, please. Charles, next, please, is a One Health Lessons ambassador. Next, please. And he is based in Nigeria. Next, and then another next. He has taken it upon himself to train, after he's become a One Health Lessons ambassador, 20 students, classmates. Next, please. And he has been able to teach over 2,000 children in guess how long? Next. In just 2 weeks. So let me say that again. This one individual, he got the training. He became a One Health Lessons ambassador. He took it upon himself to train other people in his school. And together, they taught over 2,000 children in 2 weeks about One Health. Next, please. You can do this where you are. And for the next several slides, LaShawn, just put 2 seconds, 3 seconds for each slide starting now. So this was an educational community session with adults. This was in Uganda, in Kampala, Uganda, and it was spoken in English and Luganda, and it was a community event. This was in Guinea-Bissau, so they speak Portuguese there in Western Africa. Next, please. And you see, this is taught in person. And this is in Peru. This is using technology. The class before, they just printed out the slides. Next, please. In Pakistan, this was an all-boys school in Pakistan. I would love to have an all-girls school in Pakistan taught. This is in Nigeria. Look how interactive these kids are. They want to learn. They want to ask questions. And one of the things that I ask these students at the very start is, raise your hand if you're a curious person. Most of the time, a lot of them raise their hand. And then I say, well, then you're going to be a fantastic scientist. Next, please. This is homeschooling. This mother wants to teach her children about One Health. And so she took it upon herself to teach them. Next. In Portugal. Next. Ethiopia, and this was a university class that was being taught, because these lessons are not just for children, they're also for adults and they're age appropriate. Next, please. And Basque Country. Next. So, as I had mentioned, the COVID-19 original lesson was to teach children and adults where the virus likely came from, how to protect ourselves today, how to understand what vaccines are, what mutations are, and how to protect families in the future. But this next COVID vaccine lesson is talking about mRNA, about translation, about proteins, about antibodies and antigens. And this is made for all different ages. Next, please. Feel free to connect with me on LinkedIn, as you saw in the chat box. Also, next, please, we have a lot of different social media outlets. Subscribe to the YouTube channel, One Health Lessons. You'll see on a weekly basis, we have things that are coming up brand new. And I'm happy to connect. Please let me know if you want me to come to your school and speak about this book, The Art of Science Communication. It's already mandatory reading for several university students at different universities around the world. And I'm happy to share this knowledge with future One Health advocates. Looking forward to the future of One Health because of you all. Thank you so much for your time. I'd like to conclude this with Ricky. I'll pass the mic over to Ricky with the Health Innovation Initiative. Thank you again.
Here we go. Okay, sorry. I wanted to just jump in from the Health Innovation Initiative. First of all, thank you so much for everybody, especially those who have stuck around until the end. Also, huge shout out to the whole team at Public Health Insights and my own team at Health Innovation Initiative for this event. Really great job. Thank you also to our sponsors for making this possible. Just quickly, for those who I didn't speak to at the table, at Health Innovation Initiative, we specialize in hosting events and also facilitating networking so that you can meet the best contacts for your own mission and in your own space. You can connect with us through all the sources here on the slide. We have a website and a newsletter that goes out. You can subscribe to it through our website. If you have partnership inquiries, we have an email up here. And we're also on all the social platforms. I guess if you're following us anywhere, you'll stay up to date with our upcoming events. We have one coming up in the neurotech realm. We have one coming up in the larger STEM realm in collaboration with McGill next year. And we also have a digital health-focused hackathon coming up. So thanks again to everybody. I sure met some great people. And if you would like to be further connected or missed a connection at some point, don't hesitate to email us and we'll take care of that for you. With that, I hand it off to Gordon.
Thank you, Ricky. So yes, my name is Gordon. Hello, everyone. I am one of the co-founders of Public Health Insight. And Public Health Insight is proud to have co-hosted this One Health Connect 2021 event with Health Innovation Initiative. And we remain committed to continuing facilitating knowledge exchange between researchers, public health practitioners, students, and all the other relevant stakeholders to ensure that these research findings and these discussions or best practices can be used to inform implementation of real-world solutions as soon as those knowledge become available. And One Health Connect 2021 was created as a forum to accomplish this very goal. Public Health Insight also releases a weekly podcast focused on a variety of public health and global health topics, and it reaches an audience across 2,000 cities in more than 120 countries. And in this podcast, we facilitate informative conversations that inspire community action. So if you're a podcast listener, we invite you to listen and subscribe. And the links are on this screen on the slides that you should be seeing right now. Another important initiative at Public Health Insight is a Public Health Insight Community Star, which aims to highlight the diversity of individuals working to create change for lasting impacts in their communities through the application of public health and global health practice. So, and being a community star provides opportunities to network with other like-minded changemakers, and gives you recognition for the great work that you're doing in your respective communities. So if you would like to nominate someone to be our next community star, please send the nominee's contact details to our email, thepublichealthinsight@gmail.com, shown on the screen as well, or through any of our social media platforms that you are following us from. Public Health Insight also regularly supports students and early career professionals looking to navigate the fields of public health and global health through our office hours. So if you're a student or early career professional looking for some mentorship or some guidance, feel free to email us and we can set up a time to meet. Lastly, we would like to highlight our weekly newsletter. And by subscribing to this newsletter, you'll receive the latest updates about our podcast episodes, as I mentioned before, community stars, inspirational quotes, blog posts, upcoming conferences such as One Health Connect 2021, which you've joined today, workshops, webinars, and our interactive live stream podcasts. Most importantly, the newsletter also keeps you informed about jobs, career opportunities, and provides professional development resources to you that are relevant for students and career professionals. Before we formally conclude the event, I would like to invite you all to complete a final poll that should be appearing on your screen momentarily. And if you can see it on your screen, the question is, having attended this event, so having attended One Health Connect 2021 with us today, please rate your knowledge of the concept of One Health. So I'll give you some time, I'll give you about a minute to complete the poll. Okay, that's interesting. Before, when we started the event, there were some folk, about 20% with no knowledge of One Health. And I'm seeing a lot of people feeling that the event was helpful in enlightening them about the various concepts and challenges and solutions that the One Health approach presents. So that's good to hear and good to see as well. So yes, thanks for taking that time to complete the poll, everyone. We certainly appreciate your feedback and you letting us know how the event went. All right, some folks, okay. I'll leave it open for a few more seconds. Okay, wow, it seems like, yep, people seem to have found this event very helpful, which is pleasing to us, the organizers. So thank you for the feedback again. All right, so to the keynote speakers, Dr. Sharon Deem, Dr. Kamini Walia, and Doreen Robinson, and to our Master of Ceremonies, Dr. Deborah Thompson, the One Health Connect 2021 Planning Committee would sincerely like to express our appreciation for you sharing your time with us today. We'd also like to thank our sponsors, OpGen, the Schulich School of Medicine and Dentistry Master of Public Health Program, the Canadian Network for Neglected Tropical Diseases, the Education Graduate Student Society at McGill University, and Shaping SDGs, a project led by the Global Shapers, Montreal, and Halifax hubs. And lastly, the Gairdner Foundation, from which we received a grant under the public engagement stream. As you leave here today, continue to ponder how we can all work together to transcend boundaries to build a better future for One Health. And as Dr. Sharon Deem mentioned during the panel discussion, you can predict the future by making it. Thank you, everyone.